Hey, Wholeness, welcome. This is Josh of Inner Skills, and today I have Dr. J. Paul Luftman with me. What's going on, Doc?
Hey, good to see you. Thanks for having me. Appreciate it.
Cool. So, who is Dr. Luftman? What kind of work does he do?
Yeah, so I kind of have a pre and a post, I would say. 25-year career of, doing pretty classical allopathic medicine in our westernized health system here. And then experienced pretty severe burnout. And right after that, a near fatal heart attack. And then I have the sort of post events of that, of really changing my view of the world, seeing things differently, taking in a lot of content over the time when I was recovering that I just didn't know existed. And sort of had this voracious appetite to learn more about Eastern practices and mindfulness and awareness. And, it really has informed my view of suffering, of wellness, health. And I felt like probably, with the book that I wrote and published, just last month, I had this I just felt a calling as a healthcare practitioner to tell my story to others who may be in the same kind of situation, not necessarily doctors, but people in the healthcare field. So that book, although my business that I think, in this, hopefully this piece of this larger scope that I'm just sort of launching is really meant for everybody. The original book was really, the audience was healthcare workers, because I felt like I kind of had a sense for what that stress looks like, the sacrifice that's made, the codependency that can exist, the fixing and healing, the fixing and people pleasing mentality, things like that I felt like I could speak to. And so the book is a culmination of things I was writing and reading, and trying to kind of spread the word in a new way about what I learned to help others have more wellness in their lives, and potentially my story resonates with them in some way, shape, or form.
Well, right on. We have this saying in English, right? Serious as a heart attack. And maybe it's kind of tongue in cheek sometimes, but I mean, I can't even imagine that I don't know what kind of work you did, but I mean, medically, you're very familiar on one level with hearts, I would imagine, right? But
Yeah.
then to have it happen to yourself. So, we talk about some in spiritual circles sometimes the wounded healer archetype, but that's maybe something else. But and I found in different people that are involved with recovery too, there's just a huge deep seated respect for someone that has actually gone through what they're trying to help others with. And yeah, there's no denying that you've gone through that. And I'm sure it was a huge wake up call, like you said. So I guess where the question is in this is, yeah, how did you, what was I guess, maybe if you're comfortable painting kind of as much as you think it makes sense to help the listeners, maybe a personal, like what was going on before and during and after, that would make sense to mention about it. It doesn't have to go too much in the weeds or too overly personal or anything. You could speak in generalities too, but just kind of how that wake up call was.
Yeah, I mean, I think before I got sick, I already had the wake up call, and I think in some respect, the things that I learned in the midst of sort of severe burnout and really kind of collapsing under the weight of my own life, the things that I learned coming out of that, I think helped me survive what I had to go through in a kind of strange serendipitous manner. But what you say, I like the way you put that, and in your comments before the question, it's meaningful that people speak from a place of experience. And I always felt that that was critical, especially for the years that I was doing. And I did do cardiac care. I was a primary care physician, but I did hospital care and teaching residents and medical students, and spent a lot of time taking care of really sick people, both in the clinic and in the hospital. And I think I knew even early in my career that that was critical, that somehow that the empathy has to come from a place of understanding beyond even just words to some degree. But look, I'm not in your body. I'm not feeling your pain, but I'm trying to put myself in a position to understand the kind of suffering that you're going through. And I wouldn't wish anyone to, have to have a terrible thing happen to be able to teach and be effective at that. But I think there's a certain sort of nuance that comes with being able to speak from a place of experience indirectly, in whatever way, shape, or form. The good news is, as you spoke about wounded healers, lots of people, at least in the United States, and I expect other countries and other areas of the world, uh, they are wounded healers. They can speak from a place of their own wounding, whether it was childhood trauma or other, anxiety, depression, all kinds of things that people get labeled with. But real, true difficulties that they've had to overcome, and then as a result, try to go into some type of healing space or healing, profession where they can spread that wisdom. And so I think that's the good news. People have it in their background. The issue is that I wrote about, is the blurred boundaries, is the overfixing, is not giving people a chance to feel empowered to fix themselves. Like we got to do, they're coming to me, they want wisdom, and in direct care, and yet, I think empowering people to understand that they have the power to really heal themselves with the right tools. We can just be guides in the right way. I mean, it's the same, and I go back and I give I'll just say this last piece, the analogy all the time, right? I mean, I also was dual certified in sports medicine, so I do a lot of musculoskeletal care, and we do a nice job of bracing and casting the wrist for a wrist fracture. We don't really do anything other than that, right? It was found in the past, like, the body is doing this, let's just hold it in place so the body can do what it needs to do. And so I use that analogy. I think it's great. The body, for not all the time, but in many cases, if we give it the structural foundation that it needs, and that sort of root-based kind of thing, it can do the work, and we're just kind of stabilizing it so it can do it. So I love that analogy, and I think I use that a lot, through the years of my teaching.
It's a good one. And another one that comes to mind that's similar to that is removing the things that are in the way of the body, heart, mind's natural healing process. Because as we know, just a cut, it will heal by itself, but it tends to heal quicker if there's some kind of, cleaning and bandaging on it. But then you just kind of have to wait. And farming analogies, right? Not going out there digging up the seed every 2 minutes,
Yeah.
saying grow, 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 right? It's such a mystery involved in how these things work too. And then the bedside manners always fascinates me too, what a huge impact that has on some people. And the psychological aspects around like the white coat syndrome type thing too. And yeah, it's just like any area of life. I think it's just like, who do we really resonate with? And some people will just almost automatically be repelled by certain people, and some people's heart might leap up and be, we look when, in spiritual practices, looking for teachers and friends too. So yeah, all these big mix of relationships, and all there's so many different causes and conditions, obviously, to so many areas of life. So yeah.
Yeah, I think, let me just
Yeah,
speak to one thing you said there,
please.
because
Oh,
it kind of
please.
resonated with me. Everyone's talking
Sure.
about AI. Everyone's talking about how much
Yeah, yeah.
information is out there, and clearly things are going exponentially beyond where I think our human brains can even understand where we're going to be, 5 or 10 years down the road. But my sense is that what you just said is probably going to make a comeback, right? What's old is new again. That something about when you have all the information at your fingertips, as much as a doctor has had or has learned over these years, and that's now pivoting, to a place where everyone has that. What does it mean to be a healer in that sense? And I think that bedside manner, the comforting touch, the look of understanding and appreciation, so when someone comes in with content and information, and then it can be turned into a new kind of understanding that comes with it, some degree of dialogue and reset that can allow them to understand how to get from here to there. I think is going to become ever more powerful. Now, I don't know that for a fact; it's my opinion, but I'm sensing that. I'm sensing that the whole education of healers is going to move to a new sense of not knowledge, but of sort of wisdom of how to put the knowledge together with the underlying basis of what we are made as humans, especially emotionally, mentally. That is going to somehow transform, and it's hard to imagine what that looks like. But I get some sense that it's kind of going back that way. We'll
Yeah,
see.
and In the same too, because it's testing our humanity for sure. Because, if you have some kind of robot parroting these things in front of people, at least for the time being, I don't see how that's going to be received really well by, I always tell people, I'm kind of sour college dropout to some degree. And I say I'm an autodidact. I had to relearn the love of learning after it was, kind of lost that. And now, but the thing is, what I would always want, I don't want someone that's been learning how to be a surgeon, learning that online and cutting me open. Right. So it's clear. However, now when I'm thinking about AI and I think about how they say eventually it will go to robots doing so much work, but I really, it's hard for me to imagine that time. But anything could happen in 100, 200 years. Because when my grandmother died, she barely even recognized the world she was born into. So to me, maybe it could be possible to have robot surgeons, years in the future. But like you're saying, what about like the pre-care, or whatever it's called, and the aftercare, and the connecting, and reassuring people, or dealing with existential matters or things beyond just technicalities and procedures. So yeah, I really think you're onto something there when it's maybe a new wave of training for physicians too. And I think there's a lot of areas of life, it seems like, where people are wondering, is my job going to be taken by AI? What am I going to
Yeah.
do? So
Yeah.
yeah, we're hearing these discussions all over the place. And yeah, this is really poignant to the area you're talking about too. Yeah.
Yeah. Yeah, we'll see. I have a sense. I mean, it's moving so quickly, so it's going to be hard to keep up here. But I do believe that there is something about the human touch that will have to remain a viable aspect of the healing arts. And I think, in some sense, maybe may become more important, right? I always love to go back, and I talked about it a little bit in the book, but the placebo response is a powerful thing, and nobody really understands what that is about. Is it belief? Is it understanding? Is it some sense that you're now in a trial where they're looking at your wellness, and so you're sort of like motivated to get better no matter what, right? But I mean, every trial that is done in well done scientific method now, where they're really comparing against placebo, almost all of that group, and it's thrown out, and it's so, I don't think, forgotten and disregarded. But I mean, that group almost always has a 30% response. A third of people get better, a third of people improve, a third of people, really go through some type of transformation in their life, taking nothing more than a saline pill. And it tells me that along with the other literature that's come out about belief and prayer and medicine and things, there is something going on beyond which we can measure. And I think that having what I did in the book, at least, was to try to take some aspects of those esoteric things and try to talk to my colleagues in Western medicine in a way that was still scientific enough, but sort of bring in things that showed that, hey, if you really look at deep quantum physics, it seems to line up pretty well with what the Vedic scholars were talking about, or Kabbalah, and there's something about that is powerful, that we can talk about strict science and esoteric and spiritual principles, if you want to use that word, and with some overlap that may inform how we take care of other humans going forward, and not just moving into a new age of bringing in enough things or things that have been somewhat voodoo in the past, but now have some of that strict science to back it up that everyone's been looking for. Where's the data? Okay, we have it now about on intention and the changes our brain goes through with deep meditation, right? I was just reading another article coming out of Harvard, really impressive things with the power of our brains and our souls and our spirits that, again, has been taboo. And hopefully in this age of whatever this exponential thing is going on technologically, that somehow we sort of come back to that and informs what's happening in the larger scope of the world.
Yeah, definitely. Tell people that some of these Eastern sciences and philosophies, they're so far ahead, or I wouldn't say far ahead. It's just like the Western way of approaching some of these things is kind of catching up with some of this stuff now. And look at really vast, complex areas of the mind called the Abhidhamma, these higher level sciences in Buddhism, and they have everything mapped down to mind moment, things that just arise and cease so quickly. But then we have even studies that are going into past lives and things like this,
Yeah.
where
Yeah.
it's how else do you explain these small children that have then said where they've lived before and explained it in detail, but neither them nor their parents have been there yet, and then they visit that place, and there's the scientific literature is stacking up on things like this. But the one that, and there's so many vast, complex, and some people esoteric or occulted laws that are, a little bit beyond the average person. But like you mentioned, the intentionality, that this is something, or some people call in Buddhism the law of karma, or the law of intentionality. That when I think or act with an intention, if it's skillful, it seems to have more of a likelihood to have a skillful outcome, and vice versa, right? So these are things I don't know if we can nail. A lot of us can't nail down permanently, but it. I don't know about things just happening randomly. Usually, if we ever have something in our lives where we thought we didn't know what it was, and then later we find out, oh no, it actually works like that, or what we thought might be random, oh maybe it wasn't. Maybe these other causes and conditions came into play. So then, what that points back to for me is ethics, and like the Hippocratic Oath that aligns with it's all based on non-harming, right? So, and it's a practice, not a thou shalt not, but it's like, okay, what's the least amount of harm that I can do here? Am I committed to non-harming in the world with myself and others? But not just because I want to be a goody two shoes, but this is actually, you can you can look and put it into practice and see this is for my own welfare and happiness and that of others and those around me. It's not just a commandment handed down that you're gonna, no, you can see the results in this very life many
Yeah.
times. So yeah.
Yeah. I think, in the book I specifically spoke to that, right? Because I think there was a reaction, and again, you get reactions and overreactions. There clearly is a lot of negativity going on right now in where our Western medicine world is. Understandably so. People are being harmed in different ways. And some of that's the business of it too. But I understand from going through all those years of training, why there was a reaction at, let's say, 18th, 19th centuries, and then moving into the 20th century, of saying, we don't want to harm people. There is a lot of people out there. There's a lot of folks, snake oil salesmen, all kinds of, I need to do well by my family, so I'm going to give you this thing, and it's going to work. And then people get harmed by it, right? And just too many anecdotal stories of what healing is. And there was this, backlash towards, no, we need to rigorously study this if we really want to have well-being. Let's make sure that we're comparing it against, what currently is happening, or comparing it against other things. And that scientific method came together, and I think it's given us incredible outcomes, incredible well-being throughout the 20th century, especially, right? In terms of, you can look at any outcomes: maternal deaths, fetal deaths, lifespan, probably doubling over that time period, let's say 150 years. And now we're heading into this period where, okay, it's like you talked about, these things seem to be happening that are hard to measure. It's not as easy as measuring blood pressure going up and down with a medication put in place, right? But there seems to be something about improvement in outcomes and improvement in well-being for humans and reduced suffering that does have some science behind it, seems to align with what has been taught for, generations. And so the way I described it in the book was sort of, I called it living in the and, right? It's there, we don't need to, it doesn't need to be either or. I think we can keep the scrutinous, really well done trials and scientific method to really reduce that aspect of harming, right? That you mentioned. First, do no harm being the first tenet, but bringing in with it some type of a understanding that sort of informs the decision making about what we're going to look at. So it may be sound, for example, which now has, in terms of looking at frequencies specifically, some really good emerging, data on how the frequencies seem to impact whether it's, sort of our mental state, emotional well-being, blood pressure, or other measures that we really haven't looked at that much yet. So I'm not saying everyone should just go to a sound healer at this point, nor if I do sound healing, do I want everyone to jump in with me and say you're going to be healed. I want it. I think it should be looked at. That's all I'm saying, right? Is let's take the principles of what's been done in drum circles and Native American cultures and all, and let's look at it rigorously like we have the other things. In other words, take the same approach but expand the breadth of how and what we're looking at to try to improve human well-being. That's how I speak to what you brought up.
Totally. And that, that do no harm first, that can guide us, so, and then discernment and wisdom. Okay, what is the best line of approach here for whatever I'm being faced with? And yeah, the more we limit, I think, our options, it doesn't serve us as well, and then also if a person's open to it or what kind of blowback it might have. So there's so many factors to consider. And yeah, just because we can't measure something with a machine, and we can measure a lot of these things with a lot of machines too, there are some things that are not, or we don't know if that's the full extent. But yeah, I'm just all for well-being, and where that comes from traditional science or standard Western science, or it comes, if someone's going to benefit from something on the fringe and it's not hurting anyone else, and it doesn't have much blowback, well, then that needs to be looked at too. And everywhere in between, I feel. Now, the sound thing's really interesting because it brings to mind Raymond Royal Rife. I don't know if you're familiar with this case, but yeah. So I don't know if that's been written off as quackery or what, but he definitely did a really big, in-depth study from what little I know about it of frequency and how
Yeah.
that affected certain areas of the body, and certain frequencies had certain effects. I mean, we look at
No
brainwave
question.
patterns too,
Yeah.
and how they measure that, and Tesla's famous saying, and we look at some frequencies that are like classified too, so yeah, it's beyond my scope and measurement. I'm just kind of a dabbler, a layman on the edges, but it just
Yeah.
we just think about music. We think about how we feel, the vast array of human emotions, how we can feel just by listening to music, and wanting to, and then also going into something, wanting to feel something, and then seeking out a sound to amplify what we want to feel too, and how we can use that almost like a drug, be it healing or the opposite, right, for intoxication. So to me, it's just people immediately recognize, I think, the music analogy.
Yeah.
Yeah.
Yeah, I think a couple things impacted me, and I like what you brought up in terms of that there is some literature and there is some data, and we are we have started looking at it. It's not at the point where we're going to start making recommendations. We don't know dosage, we don't know timeframes, we don't know which group of people should be excluded from the groups that are looked at because it might offer harm, right? So it has to be looked at in depth in the way that we would with the other interventions we had, and I think that makes sense. But let's not just disregard it because it seems alternative or complementary at this point, because I think there is a lot pointing towards those things, having a certain amount of power that may be above and beyond the interventions that we currently have. For me, I can tell you, and again, I wrote my book as my own experience, whether people relate to it or not, but, going into a sound bath experience, with the ambient music, with visuals being sort of like projected along the walls and of this cathedral, I can't tell you how powerful it was for me. And that was my experience, and it changed the way that I look at a lot of things in the world. And all I could do was just tell that story. I don't know if sound is going to be right for some people. I don't know if meditation and sit. I don't know if a retreat. I'm not really sure what, I want to be careful with the cookbook approach, because I think for each person and their own sort of background, understanding, if they've had trauma history, it's going to be an interesting sort of trial and error approach that person's going to have to take. I think informing that can be helpful with someone maybe like me or others who can just like go through the different options and say, based on what you're doing, maybe this seems to be a better fit than that. But who knows what it's going to be for each individual person. For me, the sound experience was incredibly powerful, and I'm convinced it was the frequency. And then I go to a sit, and I'm listening in my head to the words of Albert Einstein. I put it in the book, his quote about, he sat there and I sit here and think 99 times out of 100, nothing comes. And then I'm in silence out on a walk and things come. And, he professed that repeatedly, that when he sat there grinding on work was not when he had his best moments of intuition. And so I think sound and silence, and I really impressed upon this in the book. I think it could be very, very powerful. And I'd love to see that work continue in terms of, like I said, the specificity of it and how it's going to benefit, more specifically. But in general, it can be extremely.
Definitely a good point with Einstein. My ex partner, she said all the time, like these really big names, they constantly said that they had these other experiences that were kind of outside the box, that didn't fit into how most of the mainstream science did it. And look where it got them too. I also want to caution though, as well with, yes, and I think we need to explore this and study it, do it in an ethical manner too, because it reminds me of some of the MK Ultra experiments, right? Where they
Yeah,
had this thing called psychic driving, where they put patients and this played the loops over and over and over under different circumstances
no
too. I can't
question.
remember if they were loaded on LSD under their will, or they were or they were just given electroshock. I forget which one that particular one was, but yeah. So sound is very powerful. I think one of the things people say, there's only a few fears we're born with. One of them is falling backwards, and another one is of loud sounds. So it's a very powerful thing. They even have acoustic
Absolutely.
weapons that have
Yeah.
been declassified now.
Right.
I don't know if they really know what Havana syndrome is, or if sounds like that. I always wonder about these phenomena like the Windsor hum. And we have things, is there one in Taos too? We have this supposed voice to skull technology, which does the bone conduction for sound. And of course we hear people hearing sounds, but then we also, it's not all cut and dry. Then we have this
No
inner
question.
voice, which is a kind of inner wisdom. And there's something called a nada sound. So I can go on and on with information, but it's very powerful. I mean, most of us, I think, are visually oriented, but like for me, I think I'm more language based. But still, these two things of sound and vision, you go to a movie and how easy it is to be almost hypnotized or entranced and just forget you're in a movie theater. We talked before the show, like somebody said, nice to meet you virtually. And sometimes it's so engrossing, so immersive. It's like I forget that I'm actually talking into a computer screen.
Yeah.
So yeah, the mind and perception is not reliable, but a really well-trained mind and trained perception can be a great ally. But when it's not trained, it can be a really bad enemy.
I think
Yeah.
it's like everything else. I agree. Anything that we have found that can be beneficial can be turned and not be beneficial, right? Aspirin a day is amazing for the heart. You take too many of them, not so good, right? I think it happens with the foods we eat. A little bit of this, a little bit of that is fine. You eat too much of it, it's a problem. I love the discussion right now about the psychedelics. I think the data that's coming out is absolutely phenomenal in terms of a few doses of something in a controlled environment with the right therapists involved and maybe some sound. You're talking about people with decades of despair who have come out of that. But there are people that are harmed too, right? So if anything we talk about is going to be that balance of benefit and harm. And so I think keeping that as an informed state, making sure we're not torturing people with it, like you talked about, our government was complicit in that. Obviously, we really, I think, from an ethical standpoint, need to make sure that's avoided at all costs. But I think just keeping our minds open, and I think allowing something like the psychedelic research now to inform what other areas can look at is the way that I think we continue to hopefully heal. I don't have all the answers, and I wrote in my book, like, in talking about the sound, I think I put, I'm not exactly sure what frequency is right for which things, and that's still being looked at. But maybe someone who's in their 20s, who's just starting to come out of med school or out of a therapy program or a nursing program, is going to like have an idea when they're quiet about what they can do with it, and then look at, right. So I think it's just a matter of just exposing, bringing awareness. and just having the discussions that hopefully moves the entire sort of community into this place of just expanding what we're looking at and trying to bring in things that are going to be beneficial and reduce suffering as much as possible.
Totally. And yes, I'm all for experimentation, but like we talked about earlier, the guiding light is non-harming. And I
Yeah.
think to bring with the psychedelics, I don't think I want to jump into this because I can see both ways on this. But one thing that's for sure is it reminds me of self-responsibility. So like this aftercare notion, right? Yeah, someone can go and we can be helped with all kinds of interesting things and procedures that are very helpful and wise. And then after that, the integration process, and then hopefully, I mean, not everybody's going to do this, but how can we support encouraging self-responsibility where the power then kind of people kind of not take back their power, but in some cases take back their power. And then what can they do on their own? Because so much of, I think, the Western paradigm when it comes to healing is about fixes and quick fixes. And there's not much taught about prevention, So yeah, so that I think this comes into play too, and I don't know your views on this and how you respond to this. And I'm also interested, since you're involved in the sound world, what kind of things do you do? Is there any more detail you want to go into about sound baths and any kind of projections and stuff? How do you work with sound with clients and whatnot?
I think, like I said, I don't think it's a cookbook approach. There's a lot of different ways. I'll tell you what I do. I think, I've used the 528 hertz, frequency. I think it has the most data behind it. I've listened to different forms of that, including, let's say, there's a lot out there. I'm not going to send people to any specific source, but depending on what you're imbibing on your phone or from technology, there's just a lot where they put sort of let's say a tone at a frequency and then maybe layered in some other atmospheric frequencies on top of it, or just general sounds with different chords, or including some type of Native American flute or some singing bowls or other things. That to me has worked. I mean, it's not all the time, but a lot of times. Let's say I'm going through a difficult day or having a tough time at the end of a day where it's been just a real challenge, and I need some downtime. Putting that on in combination with a sit that I do, because I do sort of quiet sits for mindfulness work, has worked. Not all the time, but many times worked for me to help with that. And I think with people that I'm starting to work with as I'm sort of building this aspect of my career, I think it's the same thing. I think it's just, I'm not sure you're going to know until you try it, but let's like have the background inform us on what might work for you or what might not work. There are people who have been through, crazy traumatic experiences that have asked me about psychedelics. And I think at this point, with where the data is, many patients who have had, let's say, psychotic breaks are, although they may be trauma victims, they have been excluded from the trials because we really don't know the rate of harm. And so I'm not going to sit here and tell you that, you as a patient or you as a person in front of me, that that's a good idea at this point based on where the literature is. So again, the do no harm is there, and then the specificity, and then my own experience of like what I've tried and people that I've talked to, I think informs that discussion. But that's what it's been for me. And the other example I give in the book, because you brought it up, was music. It's incredible how you'll sit there, put on the radio, people will just put on, music they like or playlist or whatever. And you can sing a song from absolute, it's not even memory. It's just like, you just know the words. You're sitting there driving and it's coming out of you like it's nothing. But is there awareness there, right? Is there an ability to turn off the radio at like a micro practice, like 20 seconds, and just think about one of those phrases in the song or lyric, that can really inform, I think, and change the way based on, and I know we don't have time to go in depth into Buddhist practices and all of that, but I think that the data also shows now the attention and the awareness practice and the mindfulness seems to bring a different thought pattern that rewires. Can we do that with micro practices where you're taking a song, turning off the radio and just thinking about it and focusing on that like you would the breath or anything else? And so that was the example I gave in the book that I think could be powerful, where music can trigger a type of, let's say, structural sort of anchor that you really haven't looked at because you're just going on this autopilot of remembering the lyrics. So,
Well, it's a really good point, and there's a classic line from the suttas. Don't think good won't come to me, because drop by drop the water bucket's filled, and then conversely, don't fools think, oh, no evil will come to me, but drop by drop the water bucket's filled. So yeah, these have and it's not to be believed. We look at and know this for our own experience that there's a
experience.
gradual accumulation of things, and just think about setting new goals and stuff, how people get overwhelmed, but actually just taking one little step at a time has a gradual cumulative effect. So I would say yes, of course it can, and depending on how many times as well too. So yeah, one thing I've been doing lately is listening to these, and I don't know your whole field of expertise, but we talked about trauma, and I'm fascinated by this because it's such a huge topic. Because I tell people my spiritual karate moves, they don't really apply to trauma, and sometimes they can actually be even though I have my heart in the right place, if I don't fully understand it and know what's going on, then it could be sometimes more detrimental than not. So I've been listening to
Yes,
these survivor stories, or I would say maybe alleged survivor stories of RAMCOA. I don't know if you're familiar with this acronym or not.
I think so.
Ritual abuse, mind control, and organized abuse.
Mm.
So
Yeah.
I think it's a medical term or whatever. And so this is talking about absolute severe cases of trauma. And I think one of the reasons I've been interested in this is because what is the bleed over effect into the collective about this? Is it just isolated things? Let's just say if they are the case of what's going on, and the purported sophistication behind, these supposed called trauma-based mind control, where people are allegedly put through such severe trauma, and then different alternate personalities are deliberately created. Just as we know, when some of us have trauma, we get disassociated, and then through a science that's not purportedly professed and taught, that then these alters are then programmed in order for a business. These are all claims here. This is not legitimate medical thing for certain. I'm just repeating information. So I don't know the legitimacy of this, but the idea, my dumbed down, limited understanding of this is that then they're programmed for things like harming people, or, intelligence work for like brownstoning operations, or, trafficking, and then there's self-destruct, supposedly things built in, all this crazy stuff that you think, what?
Yeah.
But like there, and time again, there's these people coming through with really similar tales of what's been done to them, and recounting, and the methodology used in things like this. And I'm just like, wow, this is incredible stuff. I don't know really what to make with this or do with this, but I guess even not to even go into such extremes or speculation like this, how do you deal with any of this kind of trauma, or does it cross over into your practice again, or like what do you make of this whole field? I guess.
Yeah. I'm intimately aware because I experienced my own and I talk about it in the book. And I think for me, the experience that I talk about in the book, just to kind of put my own anchor into what you just asked, because I can talk about my experience with others too, but really was that as I experienced a lot of despair and a lot of difficulty in my personal life, and burnout in my professional life, realized that a lot of it was coming from this place of trauma that informed a codependency and other things that I kind of just fell into, that I wanted to try some new things, that because maybe some of the traditional therapies and medications weren't helping as much. And when I eventually ended up at a retreat, because I had found mindfulness work and some Buddhist principles and other things, that I had a no self experience myself in trying to heal myself, and was terrified. I was put in a place of absolute sheer panic in the midst of feeling my ego dissolve. And so I'm kind of the perfect example of, not all this is peachy keen. And I try to tell, I told that story in the book because I wanted people to understand. It doesn't mean I rejected all aspects of what I was doing, but I realized that I needed to have a different approach than maybe others have. That maybe some of my concentration, and I learned this specifically working with a somatic experiencing practitioner in trauma, that my orientation to some degree maybe needed to be a bit more outwards than inwards, to try to settle some of that stuff that was going on in there that had been in there for decades. Just an example. But yeah, I'm familiar with it. Yeah, I realize some of these things are not going to be helpful for people, just like we talked about with psychedelics. Some people are going to go to retreat and they're not going to do well. It's the minority, it appears to be, based on the literature that's come out. There's some new literature just that was released this week on that. It is the minority, which is great. The vast majority of people are having beneficial experiences on retreat, in silence. But understanding that it is not for everybody, and there can be harm if we're not careful, and we may need to pivot what we're doing to be able to adapt, or have those people that are trauma informed, trauma experience in their history, to change the way and adapt our approach to make sure that they're being looked at in the right way. So I would say that, without getting into the specifics of what you were talking about, this sort of mind control thing. I mean, I truly believe this stuff can happen. I think the mind's extremely powerful, and in both ways. And I think there's a lot there when it comes to the academic world that has researched, cults and cultism and things like that. I mean, there's plenty to I think, understand from a background perspective that, yeah, there's harm that can be done with repeated, whether it's verbal, visual stimuli, other things. And so, I think we have to be careful with that, with a certain group of people who are most at risk. I don't know if that answers your question, but
yeah, I think that's you addressed it for sure.
okay.
Yeah, I don't know. Like, I would love to have some really quick, easy answers to something that sophisticated and severe, but I just don't know if there is, especially quick answers, because I've listened to some people who have gone into vast detail of how it's done at great danger to their own lives, apparently, so it seems fairly high stakes for people to come out, especially in really extreme detail of how it's done and what to do about it, or at least what's worked for them, or how they've helped other people and stuff with it. So yeah, that's it.
And let me just, sorry to cut you off. I just want to reiterate. I don't want it to come across to people who are watching this as negative. My experience, although negative, informed a lot of what went forward. And I haven't stopped sitting, but I changed the approach where I made the decision that I wasn't going to go, really deep on the enlightenment path, that for me and just what I went through, I kind of followed a different path. And it doesn't mean I don't incorporate aspects of what I learned in that sit or in a lot of mindfulness lectures and things that I've been involved with. I'm extremely interested in the work, and it's really been amazing. It's opened my mind. I can't tell you how much, but it's not black or white, right? There was some degree of something that hit me, that informed me that I just needed to take a little different approach to it. So I don't want it to come off as negative, because it's not. It really was an informing that I needed. And thankfully for me, it didn't add to traumatic experiences for me. But that experience was fairly harrowing, and I had to deal with it. I had to figure out what I was going to do. If what everyone else in the room was sort of dealing with and getting positive out of, and I wasn't, okay, how am I going to adjust?
It's a really good point, because, well, yeah. Like, I'm not going to be able to go and have the interest in doing all the in-depth training you are, but I can benefit from hearing here and there about your experience and incorporating mine. And as far as, different modalities, the percentage of what works and what doesn't. And yes, we definitely need to respect that. And there's not a one size fits all for anything. So of course it will be in these areas as well. The nice thing I find about meditation, though, is if as long as there's at least enough discernment to say, oh, I'm coming up on something that I can't handle, that I'm scared of, that I can't deal with, you can come out of it like that and go, usually, as far as I know, right back to where you were. So there's, as long as no one's forcing you to just stay with it, which I don't advocate that at all. So, I mean, it's pretty easy, but now if someone's on a really, maybe a wrong dose of psychedelics and they can't just turn it off. I mean, I'm guessing there's actually some medications that you can do to counteract it and under medical supervision and stuff. So maybe that's not the case. So,
and it's still,
so maybe
it's
you
still
can
being
turn
looked
it
at.
off.
It's still being looked
It's
at,
still
right?
being looked
I wouldn't
at.
say we have
Yeah.
great answers for that yet. It's still being looked at. Okay, so like, what is going on with the psychedelic treatment and those who have difficulty? Okay, now we got to do the study on comparing this and this to be able to get them out, depending on their level of, let's say, you know, uncomfortability, social functioning, if they're having psychotic features, right? Like I would say emerging, and so you know we're getting there. I hate. The one thing I hate is that in this day and age, with the acceleration of what's happening, the way information is spread and the way people are looking at it, and everyone wants a quick fix. You know, people may be jumping in a little bit more quickly than we have the information to really support. And you know, I encourage people to be patient. It's coming, and I think we'll get there, but we need more time.
And the people that I've talked to in those areas, what I found is the integration process afterwards, they say is just as important, if not way more
critical,
important than the actual experience.
I agree with that.
But like I said earlier, if something's going to be for someone's benefit and well-being and that of those around them, especially in the long term, I don't think really anything should be off the table, you know? So it's just a matter of how it's done. And you know, like, I guess there's possibilities and there's probabilities too. And when it comes to psychedelics too, the other thing I think about is the importance of maybe medical practitioners to be familiar at least with some of the traditional settings that it's given in. I'm thinking like shamanistic settings, but also not maybe some pretending that they are shamans when they're not. You know, we go see the weird person that just says they're a shaman and then, you know, they haven't really done anything, maybe a weekend course or something. And so, like, where do these two worlds come together? You know, so I don't want to exclude anything or say, okay, this area or this practitioner in this field or modality is qualified and this one's not. I mean, I'm not someone to say that. I just think that there's a lot to be going into this, you know, and as you know, I
would love to see this. Like, I'll just give you an example. I don't think I haven't seen it. It may be out there, but I haven't seen where you have, you know, as controlled as possible, a group that has gone to Peru and sat and done this. And here is their background. Here's how many have trauma. Here's how many have depression or anxiety. Here's how many have psychotic features in their past or bipolar or something. And then compare that to a group that is sitting here in the United States going through a very sort of rigorous, let's say, sound approach. There's sound there. There's a therapy approach. Here's the exact dose of the medication they're having, not just from a brew. And comparing those groups, and here's, by the way, the background of that group, right, in terms of their own, you know, history. What do the outcomes look like? You know, what does it look like to go on, you know, on a massive retreat in the middle of the jungle versus doing it here? Is there a group that seems to do better in that setting versus a group that doesn't? Right? I mean, that to me is taking the esoteric and the real nuanced aspect of this that you're talking about, and looking at it in a format that has some degree of rigor, right? So that we can give answers to people that are a little bit more informed, as opposed to, I'm not really sure, and I hope you can find the right shaman. You know, I'm not sure I have a more specific answer than that, except that we can do what we've been doing with drugs and medications, I think, in this format too, in this similarly rigorous fashion, to give people the answers that they need as to what really might inform the best possible decisions. Some are going to be 100% right.
Well, sure, and I don't see it. They are drugs in a sense, and that means that then they're subject to the same scientific rigor as pharmaceutical drugs. I would think, to some degree or another. You know, the psychoactive compounds and how all that's measured and presented and controlled for. So now
the other thing I thought of.
Sure,
hold on one second. Sure. I want to throw this in. Put a third group in there that gets a placebo. They has no psychoactive compound, but do the therapy, do the chanting, do the music, right? If the outcomes are the same with that versus the drugs, maybe the drugs isn't the issue. Or the drugs, I want to say. Sure. The psychoactive compound maybe isn't the issue, right? But that would be lovely, right? To get that sort of larger scope thing. Yeah. So
And I
anyways,
feel that also at the same time, there's so many different causes and conditions, especially if we expand it into, what some might consider metaphysical. Like if there are previous lives, who knows how many times someone has been through something, or to account for, okay, what do you call it? Factors are being accounted for, and maybe what's not, and how much do they play in. And some things will have an idea of how significant they might be, and some things might not be significant, and so on and on it goes, even till we get into some kind of fringe area. Like I always like to ask this question: how do we even double blind test for the observer effect, right?
yeah,
So we're
yeah,
saying the observer effect has
incredible. Yeah,
but then how do we isolate that to test that
right.
itself? And you can't, it just,
I'm
my
not sure
mind
the
just kind of melts
scientific
down thinking
method.
about, right.
No, I'm not sure the scientific method works for that. And they talk,
Yeah.
the physicists have talked about that because they talk so
Yeah,
much about the observer effect, obviously in quantum physics, right? And how that impacts what they're seeing in the results. So I'm
exactly.
not sure the scientific method in our space time is the right thing to kind of measure that. So we'll see what happens in the future. But I want to go back
That's
to what
right.
you said because you brought
Sure.
it up twice now. This afterlife, and I also kind of include in there the near death experience stuff. I did talk about that in the book, and I talked about it from the sense that, as you mentioned, at the University of Virginia is a prominent site, but you have large academic centers now that have put together really nice, pretty rigorous research, not randomized controlled trials, but nice databases of thousands of people who have experienced these things now, right? So before we get to the point of saying, how does a near-death experience or some type of afterlife thing inform how someone's going to sort of do in a sit on a retreat or in a psychedelic experience or whatever, we have to get our medical community to embrace the fact that there is data showing that this stuff seems to exist. It seems to have some real weight to it in some way, shape, or form. Now, I don't know that it has to be a belief system, but it has to be something that informs the decision making of the rest that people have to really kind of like hold on to in a rigorous fashion. What I like in what I've seen that I'm really happy with is that there does seem to be a shift, and there are several really prominent people now doing podcasts, reviewing the literature that are informing this discussion in a way that is more rigorous, that people are not saying anymore it's voodoo, it's magic, but you know what, we really got to kind of look at this. There's some how are these people who are just have no pulse and are declared clinically dead hearing conversations in a room 3 doors down? It really goes back to the essence of what our consciousness is. And right now, consciousness research is at its peak. And, over the last 30 years, it's now at its peak. Where in the neuronal structure are we becoming conscious? And I think there's a lot moving towards, it's not really being created by the brain. The brain seems to be tuning into something that's happening in a more global fashion. And that's not a God discussion anymore that has religious connotations. That's really strict neuroscience research and research looking into these near-death experiences that inform the discussion about what our neurons are doing. So I love that. I love that it's moving in that direction. I think that's what needs to happen.
And I second that too, because I do finally see some of that. It's really refreshing. At the very least, if you're going to write these things off as imagination, you better sure damn well be able to explain imagination, how it works. I mean, molecule by molecule or whatever, moment by moment in the mind processes, and how exactly you can come up with this particular from wherever to how it got there. And I don't think they're anywhere close to that. So without them being able to have that as an exact science, then everything needs to be on the table until they can at least explain this away as imagination in a really rigorous scientific method or
And
manner
on the other
and
hand,
way.
right,
Mhm.
Carl Sagan, is famous for saying, extraordinary claims require extraordinary literature, extraordinary data, extraordinary,
Methods, yeah,
methods to find it. And I agree with that. I mean, what we're talking about is consciousness outside our brains, which many people believe in. But if we want to rigorously study that in a way that comes up with a sort of dogma busting understanding of what's happening here, it's going to require pretty high level evidence that I think we're building towards, but I just feel like we're in the infancy still. But I'm excited about it because based on everything I've read and everything I've researched, I think it's the right direction.
Totally. And I think it will eventually come to where there'll be other scientifically accepted tools other than physical measuring tools. So eventually, maybe it will come to where advanced degree of samadhi is considered legitimate for investigation, scientific investigation, because the advanced practitioner, I'm nowhere near this, but some of the advanced practitioners that I practice with online, there's, recall of past lives is in one sense considered a psychic power. But from what I understand, the way these meditators do, it's not a psychic power. And it's taught in certain Eastern schools, or I'm thinking of the Pak Sayadaw lineage in particular, where these advanced yogis, through very good states of concentration, can then, come out of that and then trace back moment by moment in their life until they can trace back into the fetus. And then once the moment of conception, and then the moment before that is the death moment of the previous life, and continue tracing it back. And I would be like, well, that's impossible, but that's coming from me. But you talk about people, we just have to go on their wisdom, and very wise people that we respect, and their level of knowledge and wisdom, and their heart. And then what are they saying? And it's not just one or two. I mean, it's several. And it's the other thing is, it's not a sensationalistic thing. It's just one little part of some of the practices. And the way that it comes off to me is just like, it's just another little factor in a larger other scheme of investigation and discernment that's going on through this methodology that they have. And it's just like, yeah, it would be different if they started fixating on that and sensationalizing that aspect of it. But it's not like that. It's just like
They don't do that.
They don't put any other weight on that part of the than all the other little steps in the mind door processes and things like this. So yeah, I would love to see it to get to that. But and like you said, I think we're at least on our way of feeling this stuff out, and
No
compared
question.
to like 10,
But
20
even
years ago, really hard.
You brought up Samadhi, right? I mean, what I love is there is now really good literature from the functional MRI studies and the PET studies showing, these brain patterns, right? You've had enough people now who are really great practitioners of, decades, who are telling you subjectively, at this moment, I am now in Samadhi. And you have a group of them, and now all of them seem to have the same brain pattern showing up in these things. So we're now objectively measuring what they are saying subjectively. And I think that was the first step. We've already done it towards leading towards these things where now you can accept what someone in Samadhi is experiencing, because you're also ruling out all those people who say, I'm in it, but they're not really, because, and so I really, yeah, I mean, it's, again, I believe it's in its infancy, but at least we're putting some rigor behind it so that we can start actually justifying the findings, that they have. It's great.
That's right. And even to cessation experiences, even where you wouldn't think a certain meditative state would be medically possible. And I hear there's even scientific studies on that too, with very
default mode
few
network.
advanced, advanced
exactly.
yogis. So, all right. Well, Doctor, it's been a cool conversation here. I appreciate we covered quite a bit of ground, and get to connect with your story too, and your transformational process, I would say, as well, and a grounded one and a very helpful one too. So thanks very much for coming on again. Why don't you tell people how they can get in touch with you, and then tell where people can get the name of your book and where they can get it, anything else you got going on, anything else you would like to draw people's attention to, and then leave on a final message if you'd like.
Yeah, I did get a chance to bring this up. So in one of those incredible sound baths, I had this, it just, again, during a moment of clarity, it came to me of using a term for the larger scope of what I hope to build here as a community of saturation of sound. And so that's my website, saturationofsound.com. And I love it because it has double meaning for our lives right now. I use sound as a proxy for the absolute just bombardment of our senses right now. So we are saturated in this incredible amount of information that's coming at us every day as humans. And if we saturate in sound or silence or other things similar to that, it can be very healing. So I love the double meaning of it. And it kind of, like I said, it just hit me in this moment of, being quiet. And I decided to run with it. So that's the website. The links for the book are there. and I have it's on Amazon, and I have a direct link as well for my own site. I would say, in terms of there's a newsletter there, building a community, reaching out to me directly. That would probably be the place to start. I know it's old school. I do have the links for the social media stuff there, but start there, and it should bring you in. I would say the last thing I would want to say. Obviously, the work you're doing is great. I appreciate you having me on, but I hope we can continue to encourage people to have these discussions and broaden our breadth of what we're looking at for overall well-being within humans and all sentient beings, and reducing the amount of suffering in the world. So I'm right there with you.
Here, here. Yeah, indeed. So may all beings everywhere come to know optimal health and peace, and may all beings everywhere realize awakening and be free. Bye.
Thank you, Josh.